Hi, this is Dr. Brian Palumbo here at Florida Orthopedic Institute, and today I'm going to be talking about partial knee replacements. So a partial knee replacement is when we only replace or resurface one compartment in the knee. A knee has three compartments. It has the medial or inside compartment, the lateral or outside compartment, and then the patellofemoral compartment. When we do a partial knee, we're only replacing one of the three compartments. For you to be a candidate for this surgery, the other two compartments have to be healthy, and the ACL and PCL have to be intact. The benefits of partial knee replacement are several. First, and probably the simplest, is we're taking less bone. Anytime we do joint replacements, taking as little bone as possible is extremely important. Every time you have a knee replacement surgery, we continue to take more bone. The analogy is like a candle. You can only burn that wax for so long and so much before you have very little wax to work with. So maintaining bone is incredibly important. Secondly, and probably least important, is the fact that a partial knee replacement is associated with significantly less intensity of a recovery and usually a faster recovery. Third, and probably most important, is function. The reason why I love partial knees so much is that we can provide a higher degree of function for our patients. Importantly, when we do a partial knee replacement, the ACL is left intact. And this has several ramifications. Number one, your knee feels like a knee, right? When we do a total knee replacement, one of the negative characteristics is that we take your ACL and you lose that proprioception or that feel that you have a natural, normal knee. When we do a partial knee replacement, we maintain your ACL and the knee feels more natural and it feels like your knee. The impact of this is several-fold. Number one, it just feels more natural. Patients are generally happier with a well-functioning partial than they are with a total. Another benefit is return to sports is significantly better or greater when we talk about partial knee replacements. So if you're an active patient and you play pickleball or golf or tennis, your ability to get back to those sporting activities is going to be significantly greater with a partial knee. Now that does not mean you can't get back to those sporting activities if you have a total. It's just harder and probably doesn't feel quite as normal. Importantly, when we do the surgery, I have to inspect the rest of the knee to ensure that the contralateral or the other femur tibia compartment is healthy. The patellofemoral compartment or the kneecap compartment, in which the kneecap articulates with the femur, has to be healthy. And then lastly, the ACL and PCL have to be intact. If the arthritis is too far gone and involves the other compartments, or the ACL is deficient, I will abort the partial knee replacement and perform a total knee replacement. Effectively, what I'm doing is I want to ensure that that partial knee replacement is going to last you a long time. If there's any reason I think that you're going to be needing another surgery in the next 5 to 10 years, I'm usually going to abort the partial knee replacement and perform a total knee replacement. So what are the downsides to partial knee replacement? And there are a few. Number one, the partial knee replacement is not a forgiving surgery. So a surgeon doing a partial knee has to have significant amount of experience, training, and has to do quite a few to be good. The surgeon has to be meticulous. This surgery is not tolerant to inaccuracies in the bone cuts or implant position, and that can result in early loosening and failure of the components. So it's important that the surgeon has a lot of experience and training and knowledge of partial knee replacements. I do quite a few partial knee replacements per year, generally about 50 to 75 per year. And then lastly, I have a partial knee replacement. I had a lateral partial knee replacement in 2022, and I'm incredibly happy with my knee at this point. I jog, run, I weight lift, and my knee feels, for the most part, pretty darn normal. And that's one of the reasons, one of the many reasons I'm so passionate about partial knee replacements. So that's partial knee replacement in a nutshell. Of course, if you have any questions or concerns, please don't hesitate to ask them.